Hello and welcome to The Pink Underside, Women, Men and Hereditary Cancer, a podcast by Dr. Sharlene Hesse-Biber. In this episode, Dr. Hesse-Biber talks to me, Chris Garrington, about men who carry the BRCA gene for hereditary breast cancer and the medical decisions they make about it.
For a long time, even doctors on the front line of treating breast cancer didn't think, some of them, that men could get breast cancer. So this kind of idea that only women get breast cancer was not just the case among the lay population, but it was really, and still is in some cases in the medical profession, still the case. So we have a lot of awareness to do in the medical community and beyond that really can begin to bring this issue to the forefront. Although men are at much lower risk for cancer than women when they're diagnosed with the BRCA gene mutation, very little attention is paid to the impact that this mutation status has on men's lives. And this has implications, of course, for both men and women, because men go on to have children, sons and daughters, and they're also equally likely to pass on the genetic mutation as women are. So this BRCA gene mutation, when it does happen in men, also creates not just risk of breast cancer and prostate cancer, but other cancers like pancreatic cancer and so on. So every year, at least 2,000 men are diagnosed with breast cancer, and about 400 men die from breast cancer every year. So this is getting to be a pretty serious issue, especially when you understand that men can pass this gene on to their offspring.
We tend to think of men as being pretty reluctant to talk about health issues, and something like breast cancer must be doubly difficult.
Men are have been known to be reluctant to talk to healthcare providers. They're very often supported by their loved ones to go and seek out medical treatment for an illness, but they have to go to the doctor kicking and screaming. So we already have an issue with men wanting to go and do things on their own and really not really think they can get these illnesses. And so we really have to work doubly hard to do outreach to the men on these issues as well.
So in this piece of research, you were looking to ascertain some of the differences between men who have the BRCA gene mutation. Talk us through a little bit more precisely what you wanted to look at here and why.
I didn't really want to essentialize this experience to the male population. I wanted to say that, there are young men, there are older men. The BRCA gene mutation test came along in the 1990s, and for men who were older and younger, they started finding out about the ability for them to get tested for this mutation. But each grew up in a very different kind of historical period where now, genetic testing is much more normalized, and many, many young men are much more aware of this genetic mutation than were, say, their fathers or grandfathers. And I really wanted to look at the differences among the older generation of men over 50 and the younger generation coming up who are now deciding to get married, have children, and were there any differences? Because I didn't want to get into this one-size-fits-all understanding of men who carry this gene.
So where did you get your information from? I mean, if they're not that keen to go and get tested for it, how on earth did you find men to talk to?
When I was interviewing the women early on in my research in BRCA mutations, I heard their sisters saying to me, or their mothers, my husband might have the gene and he doesn't want to get tested. Or a sister would say, I have the BRCA mutation, I have daughters. My two brothers, they don't want to talk with me about it. They have sons and daughters. I don't understand why. You've got to talk to them. So finally, when I finished my interviews with women who harbor the genetic mutation, I started to reach out to men, first through their sisters who urged them to get in contact with me. I sent their sisters materials, and I got a small trickling of men who would agree to talk with me. But for the most part, for the first year, maybe I got 3 men. I was really devastated. I was like, I'm never going to be able to do this. Well, instead of interviewing them, maybe I'll send them an anonymous survey, and eventually started posting an online anonymous survey for men to take. And if they wanted to, they could do outreach to me through an email where I could talk with them.
I'm guessing that possibly wasn't as straightforward as it might sound.
When I started, there were very few websites I could post to other than female-dominated websites. Very few websites talked about men and cancer and men and breast cancer. So a few years went by, and lo and behold, there started to become known many more websites that wanted to sort of make this awareness campaign for men and breast cancer. They really started to do this seriously. And one of the really wonderful sites I work with a lot is the Male Breast Cancer Coalition. But there are lots of other online sites that I post to. And slowly but surely on Twitter, on Facebook, where I posted information about my study, I also started my own Facebook page and Twitter page on BRCA men. And this started to gain some interest, and along with lots of other sites that started growing, and even some documentaries out there by some really incredible people making folks aware that men can get cancer and breast cancer too, hereditary cancer.
Well, a fantastic story of research perseverance. So once you got some people, what sorts of things did you actually ask them about?
Well, in the beginning, what I wanted to do was to first get that online anonymous survey going. And actually, when this article was written, it's based on about 75 surveys, online surveys with BRCA positive men, including at that point about 27 interviews I had completed, if you can believe it, with BRCA positive men. I found that once men opened up, they were more willing to talk about their stories. I didn't think they would even want to talk with me. And that, for me, was an incredible finding, that if you listen deeply to men and their healthcare issues, they will speak with you. And I think that's something doctors need to understand. So my first goal in the survey was to just understand some very simple questions. You know, the reasons why men get tested for this mutation. How did they come to get tested? And are there differences among men in their reasons to get tested? Secondly, I wanted to look at how social psychological factors impacted men and the genetic testing experience, and did that differ by, say, men's ages? And then what was it like after the test, after getting tested, and what happened in terms of men's lives after that, social psychologically and so on.
So when it came to men's reasons for getting tested for the BRCA gene mutation, what did they say?
A good portion of them told me, at least 70%, that they tested primarily for their families. This was a primary reason to get tested. They wanted to protect their children. They were, concerned about whether or not they had passed on this genetic mutation to them. Secondly, about 22% of the men told me they were worried about their medical decisions that they might have to make if they were BRCA positive. And that was a primary reason for their first thinking about getting tested. And those two big reasons came to the forefront. However, there were some differences between the younger men and the older men. The younger men, some of whom were not married yet or were thinking about having children, their primary reason, they had been online, unlike, say, the older men. They had been online, they had been aware of this mutation, and they got tested primarily for medical decisions. They wanted to see what could be done. They were on the web looking at various treatments and so on. And so this really reflects sort of a generation that kind of grew up where genetic testing was more normalized. So that tended to be a big difference in terms of reasons for testing.
And what did they tell you about what it was like for them after they got tested and found out that they had the mutation?
For many of them, I think it's important to remember, they didn't think that men could get breast cancer. And the men who were sort of blindsided by this were the older men who literally bumped into their cancer in the middle of the night. One man said to me, I got up, go to the bathroom, I bumped my chest into the door. I came out of the bathroom, I noticed that I had some blood on my shirt. And then I started feeling where that blood was coming from, and it was a lump. I went to the doctor. He didn't think it was anything. He thought it was a cyst. Another year went by, and so on and so forth, until that cancer grew and that person had a more severe form of breast cancer, genetically based. So for men and their self-concept, they're kind of blindsided to begin with. But if we look at the impact that just the genetic testing has on men, for younger men that have this mutation, there's a lot more talk about being stigmatized than the older men. The older men would say, I bumped in my cancer, I had to get a mastectomy, I have a scar, but, no big deal. But the younger men, they really feel stigmatized by it. Some of their friends think it's a female disease. One younger man said to me, I didn't really want to talk to some people, but I talked to a few people. I told them. And then one guy said, you should take those bitches off. This feeling that this is a feminine disease. I had one gay man tell me that his non-gay friend said, well, yeah, that makes sense. You're gay. You have that disease. So you can see we have a lot of work to do around these issues.
Were there any differences between men who were married and men who were single?
The married men expressed a great deal of loss of control with regard to this mutation compared to the single men. What would this mean for their children? What had they done? There was a lot of feeling of, what have I done to my children? And it was really a very emotional, after getting this diagnosis, beginning to sink in. What was their responsibility now? When should they tell their children, and so on?
And did the type of job they did have any bearing on how they responded?
Professional men felt much more vulnerable to the negative influences of being BRCA positive than those men who had already retired. I had primarily professional men in this study, although I did have some working class men as well. But the professional men felt extremely vulnerable. And it's interesting because some of the men said to me, I didn't want anything to change in my life. I had one man who was a high-powered executive, and he had a young daughter who was about 6 or 7 years old. He lived in the suburbs, and he would get up, even if, when he had his operation, he had to have a mastectomy, but he'd get up, and he was going through radiation and chemo during this time. He would get up in the morning, and it forced himself to go to work. And he'd sit, he said, I'd go to work, I'd sit, said hello to my secretary, went in my office, and I laid down on the couch for 6 hours, and then I got up and went home. So basically, what he said to me is, I didn't want anything to change about my job, about what it meant for me to have this disease, and I didn't want to mess up the family's attitudes and about their dad. I didn't want my daughter to think her dad was ill. So it's hard for men to feel vulnerable, even physically vulnerable, to this negative influences of these diseases. And their job enables them to feel normal, even when they're going through this. And I thought that was quite interesting in terms of the impact of this testing and the aftermath of testing on these men, especially their professional status, which takes up a lot of their identity.
Do you think that the men who took part in your study were what we might think of as typical? And was this important to your research in terms of sort of generalising your findings to the wider male population?
It's important to note that basically my population was anybody who agreed to take my survey. And these were primarily Caucasian men that had professional jobs, who were highly educated. I did have some working class men, but primarily that was my sample. So I'm really careful in making generalizations to any other demographics. And even I would say these were the men that were willing to talk to me. It took a lot for them to do this interview with me in particular, but also to fill out that survey. I can tell you from the interviews I did with the men, one thing that makes all of the men I've interviewed, even those that were of different demographic characteristics, some were single, some were married, some had children, some didn't. But the thing that I think set these men apart, at least the ones that were willing to talk with me, is that they had a strong female role model in their life, their mother, their sister. Many of these men had sisters who were already BRCA positive, had double mastectomies, and so on.
Now, you use something called the BEM or the BEM scale to check for feminine and masculine traits in your participants. I'm interested to know what that threw up.
The men that were willing to talk with me, all of them in the study scored extremely high on the femininity scale versus the masculinity scale. And you'd say, well, what does that mean? And yeah, I was curious about that. And one guy said, I'm not your typical red-blooded male American out there. I don't really care about sports or, I really more meaningfully like relationships with people. I'm open with them. So these men are sort of more comfortable talking about emotional issues. And one guy said, I don't have the macho gene. I thought that was interesting. But here's why they scored high on the femininity scale. They took all those items that normally were stereotypical items of femininity. I'm nurturant, yes. I care about others, check. The men who are in this study answered those questions, but they recoded their meaning. One would say to be a father is caring about your children and taking the test to help them. That's what it means to care about your family. And so they took all of those traditional, what we would think, feminine characteristics stereotypically, and recoded them into that's what it means to be a strong father, a father who cares. And I think that these men, the female role models in their lives really led them to take responsibility, to be the leader in that regard for their families. And I think they got the support for that. Many of them had very activist mothers, which I thought was interesting. And beyond that, many of the men in particular that I interviewed went on to become activists for male breast cancer, and they're out there. So it's in that sense, I think this first wave of interviews really got these men who were wanting to do something to make a difference. And so in that sense, I think they're different.
That's a wonderful impact of your research as well, isn't it? That's absolutely fantastic to hear that. I wonder, as in our recent interview about women, you also asked the men in your study to think of their lives as a pie chart and to rate how much of the pie or their life was impacted or affected by the BRCA gene mutation. What did they say after being tested?
Primarily, men walk into their mutation. Many of them had no idea that they harbored the BRCA mutation. For them, it was a wake-up call. I mean, literally bumping into their lumps. And then some of them have to have surgery right away. And others do wait. But I asked them, after this was all done with, after your diagnosis, how involved were you in thinking about BRCA, talking to doctors, going on websites? And 6 months after testing, most of the men said the mean percentage of the pie BRCA takes up is about 32 or 33%. And a lot of this involvement, if you're more highly educated, you're less likely to be involved with BRCA. Once they go online, once they educate themselves, BRCA tends to take less and less up within their lives. However, those men in the study who scored high on stigma and vulnerability as a result of getting this diagnosis, this tends to be related to even more stronger BRCA involvement 6 months after testing. This relationship still remains high, and these men are living out still the stigma. It takes up more and more of their lives. Many of the men that feel vulnerable still feel guilty about having passed this gene on to their children. And the men that are younger that are feeling vulnerable and stigmatized feel that maybe they can't have children. Maybe this means it's not a good idea to get married and have children. Some men take it really hard. I think this person was probably my most strong example of vulnerability. Is just said, I was going out with this woman. I had to stop going out with her because, she wanted to have children, and I can't have children. I have this mutation. I was sort of surprised by that. But this person took it really, really hard. I want to go into this in more detail if I can get more of these, especially these younger men now, because the stigma of having this, the vulnerability of having it, really falls hard on the shoulders of the younger men.
What are the essential things we take away from what you've been able to do so far?
I think this is one of the first studies, actually, that looked at differences among men. And we need to include in the samples difference in terms of race, ethnicity. That's missing from the study. It's really, really hard. And there are cultural barriers, religious barriers. This is true also for women of coming through. There's a distrust of the healthcare system in certain cultural groups as well. So we have our work cut out for us in trying to get more difference here among the men, that even within this homogeneous population, experience is different. Not all white men who are educated, upper middle class men have the same issues. I think that's also a message that the healthcare field needs to broaden its understanding. First of all, that men can get breast cancer, and secondly, that we can't essentialize their experiences. We need to look at their differences.
So there's a lack of awareness among medical professionals in broader society too, but I'm guessing one of the places it's having the most damaging effect is within the family itself. I wonder if you can, just to finish off, Sharlene, give us a feel for how that might play out.
This woman is pleading with her brother. She knows there's the BRCA mutation in her family. She knows the two brothers have daughters. She's their aunt. She wants to protect them. The brothers won't talk to her, won't reveal the information. Should she go above their head? Should she talk to them now that they're older? And we know when daughters do this to their brother's family, they don't want to talk to them anymore. They're cut out from their lives. This is serious stuff. It breaks up families. But one woman said to me, I don't care because I want to protect my nieces and nephews. I have to do this. So you can see these are things we've got to talk about. These are things that need to be known among genetic counselors and so on when you are talking about not just their risk factors, but what are they going to do to communicate with the generation above and below? These are all issues that are not discussed at all. They're hushed up, and the men just don't want to have anything to do with it. And, how do we reach the men? Well, we're starting awareness. We have websites now for men with breast cancer, hereditary cancer, and we're beginning to make a difference. I think we're making a difference more publicly than we are within the healthcare field itself. We still have a long way to go.
Within gender differences in medical decision-making among male carriers of the BRCA genetic mutation for hereditary breast cancer is research by Sharlene Hesse-Biber and Shen An, and is published in the American Journal of Men's Health. More information is available at www.hessebiber.com.